Hello dear doctors, welcome to the pediatrics class. For you, I have started this pediatric sessions under beautiful name of Kidscovery, where we will discover everything about kids and will try to recover along with discovering. Okay, so that's why the beautiful name Kidscovery. Myself, Dr. 𝗲𝗵𝗺𝗺. I am okay if you don't remember my name, but then I use my name as a mnemonic at various places. So I just want you to remember that. Okay. Now let me just go through the index, like how are we going to approach. So first of all, we'll discuss about neonatology, then developmental pediatrics, then inborn errors, cardiology, GIT, then hematonco, endocrine, nephro, neurology, pulmonology, infectious disease, orthopedics, rheumatology, immunology, some universal immunization schedule that will be discussed in health supervision, then dermatology and pediatric syndromes. And pediatric syndromes is one major topic, if you ask me like for your competitive exam. So syndromes are really important. Then we'll discuss about the theory and the practical. We'll discuss every aspect which is important for MCQs, theories as well as practical. So the first chapter we are starting with this pediatric neonatology. Now the very simple thing I would like to tell you is that for becoming a good pediatrician you have to become a very good detective, because children don't speak anything out, you have to detect, and children have only one symptoms, that is cry. So coming on to the neonatology, first of all we'll discuss about the general appearance and APGAR score, that will be dealt in this video only. Then we'll discuss about craniofacial abnormalities. In third video we'll have neck, chest, abdominal, genital and extremities. Then we'll discuss skin, then preterm infants problems, neonatal respiratory distress syndrome, transient tachypnea of the newborn. Then we'll discuss about retinopathy of prematurity, which is actually dealt in a good detail by the ophthalmology faculty, but still I'll discuss in short. Then we'll discuss about the neonatal jaundice overview, because in detail we'll discuss later on. Then we will have the post-term infants, Ballard scoring, IVH, that is intraventricular hemorrhages, and then you have got cyanosis as well. So coming on to APGAR score and general appearance. So let's understand general appearance and then we'll move on to the APGAR score. So general appearance, please remember, APGAR score is actually a method of assessing the newborn infants immediately after birth. So once the child is born, you are going to assess the child. So immediately after birth, you are going to assess the child and will decide that if the child needs resuscitation or not. So what we do 3 times. Okay, we do the assessment 3 times. First is done at birth. After that, we'll do at 10 minutes and then 15 minutes. Sometimes some textbooks write in 5 minutes also. So at birth 5 minutes, 10 minutes and 15 minutes. Now, why do we do after 15 minutes? After 5 minutes and 10 minutes and 15 minutes, in order to check, your success of resuscitation. So for example, at birth you checked that the APGAR score is less, you give the resuscitation. So after sometimes you have to check that if the APGAR has improved or not. If the APGAR has improved, APGAR score is improved, that means of course your resuscitation is successful. Okay, so APGAR score is actually 7 to 10 is a good APGAR score, and let me just tell you that from 0 to 1, 0, 1, 2 is the numbering which we give. So can you see here? So 0 points, 1 point and 2 points, and 7 to 10 is considered to be the normal point. Okay. So what do we check in APGAR? As the name suggests, APGAR, A for appearance, P for pulse, G for grimace, A for activity, R for respiration. Now what does this mean? So A for appearance as in what is the skin color. Okay. So if the skin color is blue or if the skin color is pale, it is given 0 points. If the body is pink but the extremity is blue, can you see this picture? The body is pink whereas the extremity is blue, then we give 1 point. Whereas if the entire baby is pink, that is given 2 points. Okay. After that, 1 point is given if the pulse is below 100. Okay. So 1. So 1 for 100 and 1 point also. So you can understand completely that if it is below 100, it's 1 point. If it's over 100, then it is considered to be 200. Okay. 2 points, not 200, 2 points. After that, you have got G for grimace. Now, what do you mean by grimace? Grimace means that what is the response the child is giving. So, if the child is giving zero response, please understand, if the child is giving zero response, that means the child is floppy. And since the child is floppy, so of course, it's going to come under 0 points. If there is a minimum response, so can you see two I's? So, I minimum is just like 1, so minimal response is 1. And if it's a prompt response, of course, it's called as 2 points. That will be given 2 points. Coming on to the activity, so please remember that if there is a zero activity, then we call it as, we give 0 point. Okay, zero activity means 0 point given. And then after that, we have got 1. 1 is the flexion of the arms and the legs. Okay, the arms is in flexion, the legs is in flexion. Okay, so flexion is going to be there. Okay, and please remember that F for flexion, F for first, and first means 1. So if there is flexion of arm and legs, you are going to give a score of 1. And in second, it is of course going to be a very active child. In respiration, of course, absent is going to be 0 if there is, okay, 0 respiration. Okay, then we give what? We give the 0 numbers. If it's a slow irregular one, so I for irregular, which looks like 1. So if it is irregular, you have to give 1 mark. If it is vigorous cry, so can you see 2 sticks in the V? So V is just like 2. So if I just make this V, can you see how many fingers are being used? 2 fingers. So vigorous cry means 2 points. So please remember, IPB is something that is important. IPB means 1 point, P for pink body and blue extremity. This is something you have to remember as a mnemonic. And why I am using this IPB? So this is I, this is 1 circle P, this is 2 circle B. So that's how you can remember if IPB. IPB means 1 point is given if the body is pink. Pink body. Okay, pink body, you will give 1 point. Okay. So this was a small discussion over the general appearance and APGAR score, and thank you so much for watching this video.